Hi everyone, Gilliam Elliott here. I've noticed a common pattern where medical tourism agencies launch with a flashy website that has all the high-tech features, but they aren't prepared to handle patient inquiries and guide people through the medical journey. Some founders assume that if they look the part, business success will naturally follow. They spend all their time on aesthetics, the color schemes, and the marketing materials. But when you look at how a successful agency functions, aesthetics is only one small part of the equation. There's a specific reason why looking professional isn't the same as being professional, and most new agencies never identify the disconnect until they run into a problem. In today's video, I'm going to show you the difference between looking legitimate and actually being prepared, so your company can operate safely and build long-term trust with patients. But before we dive in, take a moment to like the video and subscribe to the channel so you don't miss our educational content on medical tourism. One of the biggest misconceptions that people have about medical tourism is that being a medical tourism facilitator is just a specialized version of a travel agent. People think that if they can book a flight and partner with a clinic, they're ready to handle patients. But in this business, you aren't just booking trips, you're overseeing a healthcare journey. And that requires a level of preparation, responsibility, and risk management that goes beyond the basics. At its core, being prepared means having your internal systems, legal protections, and strategic partnerships in place before you ever speak with the lead. It's the engine of your business. Looking legitimate is just a paint job. While a good paint job helps you get noticed, the engine is what actually takes the patient from point A to point B safely. Now let's go ahead and look at where the work begins. It starts with patient intake and vetting. This is the foundation of everything. It's how you gather information and assess each client. An agency that only looks legitimate relies on the information collected through their contact form on their website, which typically only captures basic information and does not gather the details needed to determine if a patient is fit for treatment abroad. Because they don't collect in-depth information up front, like the current medications the patient is taking, their BMI, or any chronic conditions they may have, such as diabetes or heart disease, that can impact surgery or travel safety. A lot of times they end up going back and forth with the patient, trying to piece together that information through emails and messages. And in some cases, they move forward without having a full picture of the patient's medical condition and pass along patients who should have never been sent to the overseas healthcare provider. This wastes everyone's time and increases risk for all parties involved. However, it's a completely different story when it comes to prepared medical tourism facilitators. A prepared medical tourism company has structured intake systems. To replicate this, you need a reliable intake process, you need a system to review medical records, and you need a way to determine if a patient is even a suitable candidate for the procedure they're seeking or for international travel. Another important part of running a successful agency is how you choose your partners. Anyone can go online, find a hospital in another country, and put their logo on their website and say they're in business. But that doesn't mean any real work has been done behind the scenes. On the other hand, a professional facilitator has done the groundwork. They've verified the clinic's licenses, they've checked the surgeon's certifications and background, and they understand how the facility operates and what their standards are. Being prepared means having the patient's full medical profile, verifying the provider, and knowing exactly how the entire process will be handled before a patient commits to a procedure or travels. Doing this protects the patient, the clinic, and you as the facilitator. At the end of the day, medical tourism isn't just about connecting patients with clinics. Oftentimes, it's about guiding someone through one of the most important decisions of their life. The facilitators who succeed are the ones who put in the work behind the scenes before they ever try to get in front of a customer. If you're entering the industry and want to do it the right way from the start, we've created a certification program that walks you step by step through the process. Follow the link in the description to learn more. Thanks for watching, and I'll see you in the next video.